8 Deadly Myths about the coronavirus debunked and how to stay safe during this crisis. In this video we are going to discuss the myths that are circulating online that could be dangerous to your health. Before we continue, make sure to subscribe to our channel and hit the bell icon so that you get instant notification. Myth number 1. A face mask can protect you against coronavirus. False. Standard surgical masks cannot protect you from SARS-CoV-2. As they are not designed to block out viral particles and do not lay flush to the face. Surgical masks are only helpful for those who have been exposed to COVID-19, or who may otherwise be compromised. These masks don't limit the contraction of coronavirus. Because the virus is transmitted as droplets, are not intended to prevent us from getting a viral infection. Also, most of them are too loose to be effective. In fact, surgical masks are in dangerous short supply for medical professionals who critically need them. Myth number 2. This virus is another form of the common cold, so get a flu shot. False. There has been a lot of chatter on social media that flu shots help ward off coronavirus. The flu shot has no impact on coronavirus. Because the virus is a large family of viruses that includes many different diseases. SARS-CoV-2 does share similarities with other coronaviruses, 4 of which can cause the common cold. Myth number 3. Hot temperatures can kill coronavirus. False. There is no reason to believe that warm weather can kill the new coronavirus or other diseases. The virology of COVID-19 does not diminish in warm temperatures. And there is no reason to expect a huge decline in transmission due to warmer weather alone, according to medical experts. Myth number 4. Coronavirus is a death sentence. False. About 81% of people who are infected with the coronavirus have mild cases of COVID-19. And about 14% report severe illness, meaning they have shortness of breath or require supplemental oxygen. And about 3% are critical, meaning they face respiratory failure, multi-organ failure or septic shock. The data thus far suggests that only around 2.3% of people infected with COVID-19 die from the virus, according to a recent study by the Chinese Center for Disease Control and Prevention. Myth number 5. Bleach, silver solution, and garlic can protect you from coronavirus. False. The Food and Drug Administration (FDA) has had an avalanche of complaints. There have been false claims that drinkable silver, gargling with bleach, and garlic soup can help you avoid COVID-19. The old adage applies: if it sounds too good to be true, then it almost certainly is. Practicing good hygiene will go along to keep you safe. Myth number 6. It's not safe to receive a package from China. False. The WTO says it's safe to receive letters or packages from China. And previous research has found that coronaviruses don't survive long on objects such as letters and packages. Experts suggest that based on what they know about similar coronaviruses such as MERS-CoV and SARS-CoV, this new coronavirus likely survives poorly on surfaces present in packaging, are not ideal for the virus to survive. For a virus to remain viable, it needs a combination of specific environmental conditions, such as temperature, lack of UV exposure and humidity. And so, there is likely very low risk of spread from products or packaging that are shipped over a period of days or weeks at ambient temperatures, according to the CDC. Myth number 7. Pets and mosquitoes can pass coronavirus from person to person. Yes and no. The experts note that there is no evidence to suggest that coronavirus can spread via mosquitoes. Because the coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. As for dogs, one dog in China contracted a low-level infection from its owner, who has a confirmed case of COVID-19, meaning dogs may be vulnerable to picking up the virus from people. According to the South China Morning Post, the infected Pomeranian has not fallen ill or shown symptoms of disease, and no evidence suggests that the animal could infect humans. Myth number 8. Vitamin C supplements will stop you from catching COVID-19. False. Many individuals in chat groups and forums have suggested this. But researchers have yet to find any evidence that vitamin C supplements can render people immune to COVID-19 infection. In fact, for most people, taking extra vitamin C does not even ward off the common cold, though it may shorten the duration of a cold if you catch one. The bottom line is that you have to practice good hygiene habits. and social distancing, which means minimizing contact with people and maintaining a distance of at least 6 feet between you and others. Limit non-essential travel. Work from home and skip large gatherings. And avoid public transportation, if you can. P.S. Do you know the 3 plants you need to throw in your shopping cart to fight the coronavirus? Find out now. Click the link in the description.